Hello, everyone, and welcome to the 2024 FIP Global Pharmacy Technicians Symposium. Thank you to those joining us live and to those who are listening in afterwards. I'd also like to warmly welcome our guests and speakers today, who you'll get to hear from throughout today's symposium. Our symposium this year is titled Working Together for the Future of Healthcare, and we have an excellent lineup of speakers in store for you. My name is Ryan Burke, and I'll be moderating the first of today's two sessions. I work at the Pharmacy Technicians Certification Board in the United States. We're the largest certification organization for pharmacy technicians here in the US, with nearly 300,000 pharmacy technicians who have an active certification through our organization. And it's a privilege to be here today and to moderate the first session with our expert speakers. As you can see on this slide, we have a few announcements before we begin. Please note that this event will be recorded, live streamed on the FIP YouTube, and the recording will be available afterwards at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box provided, and I will do my best to manage the questions so at the end, the speakers can address them. You're also welcome to provide feedback at the email address you see here on your screen. And I would also like to take this opportunity to promote the benefits of membership within FIP, including these events and webinars. FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. If you're a pharmacist, a pharmacy technician, or a pharmaceutical scientist, and you would like to become a member, please register on FIP's website at phip.org. As I mentioned, we have two sessions prepared for you today, but we'll first begin with some opening remarks. After that, we have our first session that's focused on pharmacy workforce across the globe. And the second session, you'll get to hear from 3 pharmacy technicians that are working in unique roles and have unique experiences within the pharmacy technician workforce. So I'd first like to start by introducing Dr. Catherine Duggan, who will bring us some welcoming remarks. Catherine is the Chief Executive Officer of the International Pharmaceutical Federation. She took up the role in The Hague in June of 2018. And Catherine is responsible for visionary leadership, support, development, advocacy, and growth across the 200 member organizations and the 4 million members that FIP represents. Catherine is also the chair of World Professions Health Alliance, which represents more than 41 million healthcare professionals worldwide, representing the world's dentists, nurses, pharmacists, physiotherapists, and physicians. Catherine, welcome. Thank you so much for being here with us today.
Thank you so much, Ryan. It's an honor and a pleasure to be with you today and to be part of the scene setting, the opening remarks part. So I will echo Ryan's welcome. Good morning, good evening, good afternoon to everyone. Welcome in real life, in live time, or after the event. Welcome to the 12th FIP Global Pharmacy Technicians Symposium 2024. It's a true honor to have you all with us today as we gather to celebrate and explore the essential contributions of pharmacy technicians to healthcare worldwide. As Ryan said, I'm the FIP Chief Executive Officer, which is a true privilege. And it gives me great pleasure to be part of today in the opening remarks session. As Ryan says, we're one big family across the world seeking together to advance pharmacy worldwide. And as many of you know, today, the 15th of October, is World Pharmacy Technician Day, a day dedicated to recognizing the critical contribution pharmacy technicians make to healthcare. This day provides a moment to reflect on the vital role that pharmacy technicians play, not only in patient care, but also in shaping the future of the healthcare workforce. Your role is essential in today's increasingly complex healthcare systems, and today's and tomorrow's discussions reflect this. The theme of this year's symposium is rightfully working together for the future of healthcare. We had our Congress recently in Cape Town, and we know the African phrase of you can go far alone, but you can go further together is really essential. And this theme highlights the importance of collaboration between pharmacy technicians, pharmacists, and other healthcare professionals to improve patient outcomes and address the challenges facing our healthcare systems. As we all gather for this symposium or revisit it later, one of the key issues today that we'll be exploring is the importance of building relationships within the pharmacy team. Strong relationships within the pharmacy team are the cornerstone of effective patient care. When pharmacy technicians and pharmacists work closely together with clear communication and mutual respect, it improves the overall functioning of the pharmacy, optimizes patient outcomes, and improves the safety and quality of care delivered. This is especially important as the scope for practice of pharmacy technicians continues to expand, requiring advanced clinical knowledge and expertise, together with growing and continuing in our CPD. Today, in some parts of the world, pharmacy technicians are taking on increasingly complex roles, such as providing immunization services, working in clinical settings, and supporting pharmacists in ensuring the safe and effective use of medicines. As healthcare systems evolve, and as our governments and societies struggle with the changing demands on everybody's healthcare system, so must the role of pharmacy technicians. This brings us to another important topic. We will address this, and that's the growing demand for qualified pharmacy technicians globally. As our healthcare sectors face increasing pressures from workforce shortages to increasing complexity of patient care, the need for skilled, well-trained pharmacy technicians has never been greater. The integration of artificial intelligence and other emerging technologies into healthcare also presents both challenges and opportunities, and we will explore these in the symposium. Over the next 2 days, we will explore all of these and more, with discussions ranging from expanding scope of practice to the ethical responsibilities we have as we take on more clinical roles, as well as the global perspectives on the pharmacy workforce and the important role of pharmacy technicians in public health and patient care, especially in the area of immunisation. I encourage you all to participate actively, share your insights here in the chat box, afterwards with the team, with each other, as we work together to shape the future of healthcare. A huge thank you from me to you all for being here, and I wish you all a productive and inspiring symposium. Have a great time.
Catherine, thank you so much for those remarks and for being with us for this session. It's now my pleasure to introduce Susan James. Susan is the acting registrar at the Ontario College of Pharmacists, which is the regulating body in Ontario, Canada, for pharmacists, pharmacy technicians, and pharmacies. As a member of the senior executive team, she provides strategic leadership in the areas of registration, competency assessment, and pharmacy practice. During her tenure at the college, Susan has been instrumental in the implementation of regulated pharmacy technicians and continues to promote the integration of pharmacy technicians within pharmacy practice locally, nationally, and internationally. She is the current chair of the FIP Pharmacy Technician Advisory Committee and has been working with FIP since 2013 to support the development of the pharmacy support workforce globally. In 2019, Susan was awarded FIP Fellowship for these contributions. Susan, thank you for being here with us today.
Hello, are you able to hear me?
Yes, we can hear you, Susan.
Okay, I'm sorry. I'm not sure what's happening with my video at the moment. So I'm going to speak just from my voice, and perhaps the video will pop on in a moment. Hello, everybody. I'm so delighted also to be here with you today. Thank you, Catherine, for your very kind words. It's so wonderful to have you here to join us. We know that you are extremely busy, and it is wonderful to know that you're here continuing to support the work of the pharmacy technicians and the work of the Pharmacy Technician Advisory Committee. Hello, everyone. Thank you for joining. Those of you who are live and those who will join us later, as the others have already said. I also want to start today by saying congratulations and happy World Pharmacy Technician Day to all of you who are out there making your contribution to improving and enhancing the work of pharmacy services around the world. I know that you are all highly committed, dedicated, contributing to the efforts of pharmacy services. And because of your efforts and your contributions, you're helping to improve the lives of many people worldwide. I'm very excited. As Catherine said, this is our 12th symposium for the Pharmacy Technician group to be hosting. And this is our 4th webinar that we have been doing. We transitioned to this world where we recognized that we were able to reach out to many more people and have been so pleased with the number of individuals from the variety of regions that are able to join us when we do these webinars. We do host webinars through the year, but are always very excited when we have the opportunity to come together for these 2 days to have a number of sessions that follow each other, because it's through that opportunity that we really are able to build on the conversations. And we look forward to having each of you engage with us, participate, as Catherine said, in those conversations. I'm not going to talk about the sessions. Catherine has given you a little bit of introduction to that, but I do want to let you know that many of the speakers are individuals who are members of our Pharmacy Technician Advisory Group. We have been in existence for the last 5 years with FIP, and there are a number of people who are working together to contribute to the efforts, the initiative of FIP. I thank all of those individuals. Ryan particularly is our host today and has been for a number of years now, taking on the lead for all of our webinar sessions and particularly these symposiums. So thank you so much, Ryan, for that. And a thank you to all of our Pharmacy Technician Advisory Group members, those of you who are contributing today and those who have reached out to many of our other speakers and are assisting in ensuring that we have this opportunity to come together and share the knowledge that so many pharmacy technicians have for you. I do want to just mention that some of the particular efforts that the Pharmacy Technician Advisory Group is working on is the development of a competency framework, which will follow the framework, competency framework model that FIP has so successfully been publishing over the last few years. And we will be exploring what the competency framework for the pharmacy support workforce will look like. It will provide an opportunity to see how pharmacy technicians work at a couple different levels, recognizing that the role is supported in different ways to meet the local needs of the various regions. We're excited that that pharmacy competency framework is, pharmacy technician competency framework is close to its fruition, and we look forward to releasing that sometime next year. Likewise, we have been working on a glossary project along with other groups within FIP so that we can come together and understand the various terminologies that are different across the world and begin to understand better. Isn't that part of working together in relationships, language and understanding what we are all talking about? We use different words sometimes that we understand differently, and this glossary is intended to help to understand those common pharmacy words. Pharmacy technician, for example, one that is understood very differently in different regions. There are different terminologies for pharmacy technician, pharmaconomist, pharmacy technologists, various names that are used in the glossary will help us to all understand what we mean when we use those words. So I would like to welcome again all of you. As you've heard, we would welcome all of you, any of you, to contribute, to participate with FIP. And if you're interested, to send us a note and let us know if you would like to join the work of the Pharmacy Technician Advisory Group. We are always welcome to more individuals to contribute, to share, and to support the contribution of pharmacy technicians. Thank you. With that, I'll turn it back to you, Ryan.
Thank you, Susan. Very much appreciate you being here and sharing those thoughts with us. And I want to echo Susan and Catherine's happy Pharmacy Technician Day to everyone that's in attendance, and most certainly to our speakers today who are pharmacy technicians and are spending part of their day sharing their expertise with all of us. So with that, we will get right into the first session, which is entitled Pharmacy Workforce Across the World, Global Perspectives and the Role of Artificial Intelligence. We know that there are lots of challenges out there related to the pharmacy workforce, and during this session, speakers will share insights into the issues impacting their respective countries, including workforce shortages, evolving roles, and regulatory environments. We also have one speaker that's going to focus on the transformative potential of artificial intelligence in pharmacy technician education. We have 3 learning objectives for this first session. The first is to identify key challenges and opportunities facing the pharmacy workforce in various countries around the world. The second is to compare training and responsibilities of pharmacy technicians across the world. And finally, understand the potential impact of artificial intelligence on pharmacy technician education. We have several excellent speakers lined up for you today. And the first session, or the first portion of this session, will be focused on empowering pharmacy technicians and the support workforce. And our colleagues from FIP, Sherly and Nisa, are going to share some insights from the Global Workforce Surveillance Project. And so at this time, I will introduce Sherly and Nisa. So Sherly Meilianti is an Indonesian pharmacist and currently working as the data and intelligence specialist at FIP. Passionate about global health and workforce development, she holds a PhD from UCL School of Pharmacy on the analysis and transformation of the pharmacy workforce in Indonesia. Her work within the FIP related to data management, collation, analysis, and intelligence reporting across FIP, with a weighting toward the Global Pharmaceutical Observatory and the One FIP project. Additionally, Sherly serves as the FIP liaison for the World Health Organization Global Health Workforce Network Youth Hub Steering Committee. She is passionate about youth advocacy in global health. In this role, she works with an interprofessional team to drive youth-inclusive policy locally, nationally, regionally, and globally. And then our second speaker, Nisa Masyitah, is FIP's Project and Data Support Coordinator. In her role within FIP, she is working on several projects related to the surveillance and multinational needs assessment programs. She is involved in supporting data management, collation, analysis, and intelligence reporting across FIP. Nisa studied pharmacy in Indonesia and became a licensed pharmacist in 2017. She obtained her master's degree in global health from Geneva Graduate Institute in 2022. And so with that, I'll welcome Sherly and Nisa and turn it over to you to share your expertise with us.
Thank you very much, Ryan, for the kind introduction. Hello, everyone, and thank you so much for joining us today. And happy World Pharmacy Technicians Day to everyone today as well. So as Ryan said, my name is Sherly, and together I will double act with my colleague Nisa. We will be sharing some key insights from our Global Workforce Surveillance Project, focusing on pharmacy technician and support workforce. So how is the Global Workforce Surveillance relevant to our discussion today? This is because in our surveillance project, we are monitoring and understanding the trends of pharmacy workforce. And this information will be able to help us to see where we are, identify some gaps, and also find ways to improve. And today, we would like to share some findings, and hopefully this will be useful to empower the role of pharmacy technician and support workforce in the health system. So if we go to the next slide, we would like to first sharing the existing policy and evidence related to pharmacy technician and support workforce. As you all may be aware, we also listened from Susan and also from Catherine today about working with others. So one of our development goals is FIP development goal number 8, which is working with others. This goal highlights the importance of collaboration within healthcare team, including pharmacy technician and also pharmacy support workforce. And by fostering intra and interprofessional collaboration, we can ensure that pharmacy technician and pharmacy support workforce can be supported in their role. And the second thing that we would like to highlight here, building on the FIP development goals, that we recently have FIP statement of policy in interprofessional collaborative practice. And this policy also recognizes the needs for healthcare professionals to work together to improve patient outcomes. And pharmacy technician and support workforce can play a role in this collaborative care setting. So that's the policy that we would like to highlight. And let's now look at published evidence that we have. So if we can go to the next slide, we have these two evidence that we would like to highlight. The first one is a peer review paper published in 2016 and a detailed report on technicians and pharmacy support workforce cadres working with pharmacists. This evidence highlights that there is a variation in the role, education, supervision, and regulation of pharmacy support workforce around the world. This study also found while some countries have well-developed systems, others are also still working on formalizing the roles of pharmacy technicians in the country. From this data, it was recommended that a more detailed understanding of specific country setting need to be explored to optimize the roles of pharmacy technicians and pharmacy support workforce. In this report, we also highlight some country case studies that you can see a range of practice models across several countries. So feel free to have a look at these two reports, the report and also the peer review publication afterwards to look at the information about the roles and responsibility and the healthcare model, the practice models of pharmacy technicians in some countries. If we can go to the next slide, we know that the data that we have, the previous report that I mentioned is kind of like over 6 years ago. So last year, we conducted FIP Global Workforce Surveillance Project, aiming to collect data on pharmacists, pharmacy technicians, and also pharmacy support workforce worldwide. We distributed an online survey in multiple languages to reach our stakeholders in different countries. And we gather national data on capacity, on the supply pipeline, and also on the education and training system in the country related to pharmacy technicians and also pharmacy support workforce. And that's something that we would like to share with you all today. So if we can go to the next slide, we want to let you know about what we have learned so far from this data. This data tell us that in 2023, there are over 678,000 pharmacy technicians across 35 countries. And the number of the pharmacy technicians is actually vary across region. For example, Europe has a higher density of pharmacy technicians compared to Africa. And apart from the region, there is also a significant difference between the income level, where the high income countries have the higher density compared to the lower middle income country. Apart from that, we also found that the ratio of pharmacy technicians to pharmacists also different. And this actually highlights the approaches, the different approaches of pharmacy team structure globally, which actually support the evidence that we provided to you before, which is the 2017 report. And echoing one of our Brisbane call to action, this data actually shows that developing a policy and best practice that will optimize a skill mix for pharmacy team in all sectors is very important and essential. So working with others and then including pharmacy technician and pharmacy support workforce and empowering their role is very important. And if we can go to the next slide, we would like to highlight some information about supply pipeline of pharmacy technician. We identify around 792 pharmacy schools across 36 countries, and 94% of them are accredited. This accreditation rate is actually a positive sign, which is good. And if, for example, we look at the picture on the left side, it's actually showing a similarity with the previous information that we share, where you may see like this, the red circle, which is actually, there's a blue circle there, which is the African region. All of them having less schools and also less new register compared to the Europe region, which is the purple one, which is like having more towards the right side and also the top side. this showing a really a regional difference between region related to the supply pipeline as well of the pharmacy technician and pharmacy support workforce, with actually echoing the earlier finding that we share with you. If we can go to the next slide, I would like now to invite my colleague Nisa to share more information about the education and training system that we found from our survey. Nisa, over to you.
Thank you very much, Sherly. It's a great pleasure to be here with you all today. Now, I would like to share some key findings on the educational requirements for pharmacy technicians across various countries, as Sherly mentioned before. So for the initial education, our survey indicates that nearly half of the countries surveyed, specifically 48.8%, require a minimum of 3 years of full-time education. Experiential learning or internship is also a crucial component of pharmacy technician training, and our findings show that 6 months of hands-on experience is the most common requirement, and it is reported in 38.2% countries. There is a variance in the education and training programs, as you can see, which highlights the need for equitable investment in education to ensure a sufficient workforce that can effectively support the delivery of pharmaceutical care. Next slide, please. Let's now discuss the role of pharmacy technicians in the healthcare system. Our survey found that 48 out of 71 countries recognize pharmacy technicians as integral components of the pharmacy workforce. And this recognition underscores the essential role of pharmacy technicians in providing pharmaceutical services. Additionally, 36 countries have established membership bodies or associations that provides national support for pharmacy technicians, which suggests that there is a broader understanding of the value that pharmacy technicians bring to optimizing healthcare provision. In terms of their professional roles, 33 out of 60 countries have a defined scope of practice for pharmacy technicians. But despite these developments, less than half of the countries surveyed have established practice standards and competency frameworks. And based on these findings, we can see that there is a need to advocate for the development and implementation of competency frameworks to clearly define the knowledge and skills required for pharmacy technicians so that they will meet the established standards of practice. Next slide, please. Okay, when it comes to the continuous professional development programs, or CPD, among 49 countries that recognize pharmacy technician, 21 of them offer university-based formal education program for CPD. And this is an important finding because it indicates a commitment to providing accessible professional development opportunities for pharmacy technicians. Regarding the primary providers of CPD, our survey identified several key contributors. And this includes commercial or private sector companies, followed by pharmacy unions or professional organizations, universities, professional leadership bodies, ministries or government-related providers, and regulators or pharmacy councils. There is a diversity in CPD provision, which highlights the importance of fostering collaboration among these providers so that the quality and accessibility of CPD programs can be enhanced. Next slide, please. In addition to data from the previous slide, our survey also found that among 68 countries, 30 of them reported that CPD is mandatory, while 7 countries offer CPD voluntarily. This indicates that there is a strong commitment to ensuring ongoing professional education in many countries. Furthermore, 16 countries or 23.5% require pharmacy technicians to complete a specific amount of CPD credits for license renewal, while 10 countries, or 14.7%, include CPD as part of a broader license renewal requirement. However, the majority of countries do not mandate CPD credits for license renewal, which indicates a room for policy development to ensure consistent professional development standards across countries. When it comes to linking CPD to portfolio submissions, such as reflective diaries or case study report, 7 countries, or 10.8%, CPD requirements with an annual portfolio submission, while 9 countries, or 13.8%, incorporate only some into their portfolios. However, the majority do not establish any link between CPD and portfolio submissions. Next slide, please. So the findings from the 2023 survey that I just shared highlight significant gaps, particularly in regions where information on the pharmacy workforce, especially pharmacy technicians, is either limited or inconsistent. And addressing these gaps will be critical in enabling more accurate workforce assessment and supporting evidence-based policymaking. Next steps, we would like to extend invitations to member organizations and other stakeholders to participate in our upcoming survey in November 2024, which is just a few weeks from now. And this survey aims to address these gaps that I just mentioned and to monitor the global trends so that it could help us understand better in terms of the roles, responsibilities, capacities, opportunities, and challenges faced by pharmacy technicians and the support workforce. So we look forward to your participation. And if you have any questions about the upcoming survey or the current 2023 findings, then please don't hesitate to leave us a message at our email address, observatory@fip.org. That's all from our end. Now over to you, Ryan. Thank you.
Thank you so much, Sherly and Nisa. I think that was an excellent start to this portion of the session because it really gives us a great global perspective of what's happening related to the pharmacy technician workforce. So thank you again. And there will be some time at the end of this session to ask questions of all of the speakers. And so if you have anything on your mind at the moment, you're welcome to go ahead and submit that now in the Q&A box so that way we can address your questions at the end of this session. So it's now my pleasure to introduce our next speaker, Lyane Pennell. Lyane is a dedicated educator and healthcare professional with over a decade of experience in pharmacy. She holds a Master's of Education specializing in technology, enhanced learning, and leadership, and is currently pursuing a Doctor of Education. Her doctoral research focuses on integrating generative artificial intelligence and digital tools into bilingual hybrid pharmacy education. As the COO of RIP Solutions, adjunct professor at the University of Iowa, Lyane has led initiatives to enhance digital competencies in healthcare education through innovative methods like alternative assessments. Her expertise lies in merging education and technology, particularly in utilizing AI to improve pharmacy training and student engagement. A bilingual leader and lifelong learning advocate, Lyane is committed to transforming pharmacy education through flexible hybrid learning models. And Lyane is not able to be here with us in person today, and so she has graciously recorded her presentation, and I'll play that for you in just one moment.
Hi everyone, my name is Lyane Pennell, and I am here to talk about the role of AI in pharmacy technician education. So I've been teaching at Cité, and I am affiliated with the University of Ottawa, where one of my focuses is on enhancing digital competencies in pharmacy education through alternative assessment. So a bit of the context setting here. So here's a table of contents. If you want, you can scan the QR code and follow along with this interactive presentation as I am speaking. So just a little overview. I'm just going to go over the introduction, quick context and objective, a little bit of history on AI in education, a bit about digital competencies, alternative assessments with AI to really hone in on those digital competencies, a case study of a course that I've been doing alternative assessments in, and a bit of the key points of how this different type of assessment develops critical thinking. And then I'll just make a few conclusions as well as share my bibliography of everything that I've read and sourced throughout this presentation. So a bit for the context setting, the healthcare landscape is rapidly evolving with increasing reliance on digital tools, artificial intelligence, and electronic health records. And this shift also requires pharmacy technicians to develop strong digital competencies. According to a report by Deloitte, the global healthcare sector is undergoing rapid digital transformations, which is mainly driven by AI and data analytics. So there's studies that are showing that healthcare professionals, including pharmacy technicians, are now expected to be proficient in using digital systems like EHRs and patient management software. NAPRA, which is the National Association of Pharmacy Regulatory Authorities in Canada, as well as VIP, the International Pharmaceutical Federation, emphasize this growing need for digital competencies as essential to modern pharmacy practice. So given this transformation, traditional teaching methods are not quite enough when it comes to teaching pharmacy technicians, and we need to innovate assessments that build these digital skills alongside the knowledge. And so these trends underscore the importance of embedding digital tools and competencies into pharmacy technician education. So today, the objective is really exploring how integrating alternative assessments using artificial intelligence into pharmacy technician education can foster this critical thinking and enhance students' digital competencies, which is going to prepare them for the demands of the modern healthcare setting. So a bit on AI in education, so the history and some brief benefits. Just a bit of a disclosure here. For the purpose of this presentation, I'm typically referring to Gen AI when I'm talking about AI. Here's a little infographic that I had made sort of explaining how a lot of the verbiage that we're seeing around AI now is really referring to ChatGPT, but this is just a little reminder that there is a lot of different types of artificial intelligence that exists. So for the historical context, essentially AI really started in education in the 60s with early experiments in computer-assisted instruction and intelligent tutoring systems. However, it wasn't until the late 20th and early 21st centuries that AI started making a real impact. And then we saw advances in machine learning, natural language processing, and data analytics, which have really turned AI into a powerful tool for enhancing the educational experience. And so generative AI, which falls under narrow AI, is focused on specific tasks like generating text or solving problems based on previous data. And how this benefits education, essentially these large language models like GPT take AI's role further by simulating more human-like interactions, where unlike traditional AI, which is often task-specific, these large language models can generate diverse content, explain complex concepts, and provide detailed feedback, all based on the nuanced inputs that they receive. And so the ability to handle more complex, unstructured tasks makes these models particularly promising for developed critical thinking skills. And so by having this integrated into learning systems, we can deliver the personalized education. And Gen AI is now really being used in courses and programs to deliver the knowledge and critical thinking skills. So a bit on digital competencies in pharmacy education. So just a really brief overview of why we need to develop digital competencies in pharmacy. There's a lot of research, there's a lot of frameworks that have been really showing the importance of digital competencies, the importance of digital literacy, the importance of digital health. And so, as previously mentioned, this digital transformation is in full swing, which places significant emphasis on the development of digital competencies for pharmacy professionals, because these skills are essential for navigating tools like just your basic EMR, medication management systems, patient care technologies, and we have to be able to learn this to ensure efficient and safe pharmacy practice. And NAPRA and FIP, essentially, furthermore, they really emphasize this digital literacy as a vital competency for pharmacy professionals. And so by integrating digital literacy into education, we ensure that pharmacy technicians are prepared to handle the complex tech that's required in the modern healthcare environment. So we generally understand the importance of digital competencies, but how do we achieve making our pharmacy workforce obtain these competencies? And how is this linked to AI? And so then this brings me to alternative assessments and generative AI. So there are many researchers that are really looking at the impact of using AI within the courses to really formally structure the education for students using AI instead of completely avoiding it. And so one of this method of doing it is through an alternative assessment. So instead of having a typical examination or quizzes, an alternative assessment is really a non-traditional method that we are using to evaluate the student learning. And so I'm going to present a case study. And so I switched this alternative assessment into my Informatisation du dossier patient, which is a computerization of the patient profile course in the French College here in Ottawa, Canada. And I'm going to just show you a bit how I did that and what the outcomes were. So essentially, the case study, the previous assignment in the course was a document that had 6 pre-made prescriptions where students had to identify the components of the prescription and whether they were valid. Instead of doing this type of assignment, I decided to give them options. So instead, I asked them to either create an infographic with the correct elements highlighted with an interactive tool like Genially or Canva, or they could have a conversation with ChatGPT or any type of generative AI about what is essential on the prescription. And then they had to compare this to what I taught in class. For the most part, students chose interacting with AI, but I saw that this option of choosing how you are doing the assessment also gives that student the choice of how they want to learn. And regardless of which they pick, they're developing digital competencies because they're having to learn a new software for either. And so here is a few examples that I had for my students. So here's an example of a student that decided to do an interactive diagram. And then these are 2 students that did different large language models. So this is Perplexity, and then this was ChatGPT. And at the bottom here, he wrote a bit of a reflection on like most of the stuff is the same, but not everything is exactly the same as what we got taught in class. And so this brings me to this next point of how the AI-assisted prescription analysis is really helping them develop their critical thinking. Essentially, it's teaching them to formulate effective prompts. It's teaching them comparative analysis. It's teaching them the recognition of AI limitations. And of course, it's developing their metacognitive skills. So in terms of formulating effective prompts, they really have to analyze the key components of a prescription. They have to break down the complex concepts into clear, specific queries. Otherwise, the prompts will be too generic. Also, they really have to anticipate the potential misunderstandings or ambiguities of the AI. If the AI isn't trained specifically on make a prescription legal, it's obviously going to hallucinate. And so developing these skills is crucial for future pharmacy professionals who will need to communicate clearly with patients, healthcare providers, and automated systems, because it really helps them break down how they are going to approach a subject. Next, we have the comparative analysis. So here is where I was asking them to identify the discrepancies between the AI-generated information and what it is that I teach them in the course. So this evaluation really makes them see the completeness and the accuracy of the AI's responses and allows them to see if there's any potential gaps or errors in the AI's knowledge. And so this is important to really sharpen the student's ability to critically evaluate the information from various sources. Along these lines, recognizing the limitations of AI, This project demonstrates that AI, while powerful, is not infallible or omniscient. It also encourages the skepticism and the need for verification of an AI-generated information by comparing it to the class notes. And it also reinforces the value of the human expertise and judgment, because at the end of the assignment, they're still asked about reflecting, is it the same? Is it not the same? How is it different? Just simple contrast. And so recognizing AI tool limitations is not just important to effectively use AI, but to also responsibly leverage AI. And lastly, the development of the metacognitive skills. Essentially, this homework really encourages an active recall and application of the learned concepts, because they're constantly having to ask the questions for the AI based on the knowledge that they've acquired in the course. So it's actively making them recall what was taught. It's also evaluating the effectiveness of their questioning strategies. They have to know what questions to ask based on the output that they want to see. And the output they want to see is matching what I'm teaching. So this really makes them work on rewording their questions, breaking down their questions. And so by doing this, it's really identifying their own gaps in their knowledge or areas of improvement, essentially like the prompting engineering of this assignment. And so these metacognitive skills are really crucial for fostering lifelong learning, because you're evaluating what you don't know and how you're going to achieve to get that information that you don't know. So overall, by engaging the students in this AI-assisted analysis of prescription requirements, the educators are really fostering critical thinking skills that go beyond just the mere memorization. And so this brings me to the conclusions already. So by engaging students in AI-assisted comparative analysis of prescription requirements, we are really fostering critical thinking. And so this approach really prepares future pharmacy professionals to navigate a world where AI tools are increasingly prevalent, while also reinforcing the irreplaceable value of human expertise and critical judgment in healthcare. And so this method really aligns with contemporary educational theories that emphasize active learning, problem solving, and the development of higher order thinking skills. It represents an innovative use of AI in education, and it's not necessarily a replacement for traditional learning, but as a tool to enhance and deepen the learning experience, because we all know that these students are going to be using these tools outside of what we're teaching. Throughout this presentation, we've explored the transformative role of AI in pharmacy technician education. Essentially, AI in education has really made us have to reshape how we think when it comes to teaching and education. We have to really modify how we are teaching to make sure that we are up to the times, which in our case right now is really developing those digital competencies, because there's such a growing importance on digital literacy. And a way that we can do this that is a simple switch is just alternating our assessments, not changing the content, but just changing how it is that we are evaluating the students. And through this AI-assisted assessment, it really helps students develop the critical thinking, the metacognitive skills, and digital competency. There's obviously a lot more that I'd love to explore beyond these 15 minutes, but I hope that you've learned at least one new thing that inspires you to explore these tools further. So I would really like to just say, as we move forward in this rapidly evolving digital age, I encourage you all to explore the potential of AI and interactive tools in your own environments. Whether you're in education or another field, experimenting with tools like ChatGPT or Genially can really open up new possibilities for engagement and skill development. And that is it for the presentation. Here I have 2 slides of bibliography that are all hyperlinked. So if at the beginning of the presentation you were able to scan that QR code, you'll have access to all of these references. If you have any questions or comments or would like to know more, feel free to contact me through LinkedIn if I'm not able to make it in the chat for this presentation. So thank you so much.
Right. I want to thank Lyane again for sharing that great presentation about the potential of artificial intelligence in pharmacy education. And when we get to the end, if there is an opportunity for Lyane to join us virtually for the chat portion or the Q&A portion, you'll be able to ask her questions at that time. And if not, of course, she did provide her contact information. So with that, it's my pleasure to introduce our next speaker, Mariet Eksteen. Mariet is the Professional Development Officer at the Pharmaceutical Society of South Africa and currently the global lead for advancing integrated services in the FIP Hub. Mariet has been a member of FIP since 2008 and was awarded with FIP Fellowship in 2021. Mariet enjoyed involvement and participation in FIP on numerous occasions and levels. More importantly, these new experiences and skills filtered through to the South African context to enhance and uplift the profession locally, but also allow an opportunity like today to share our context with the world. So with that, Mariet, I'd like to welcome you and turn things over to you.
Thank you very much, Ryan, for that kind introduction, and good morning, good afternoon, and good evening, everybody. Whether you're joining us today on World Pharmacy Technicians Day or you're accessing the recording afterwards. It's a privilege for me to represent the Pharmaceutical Society of South Africa in giving you a snapshot in how the pharmacy workforce works in South Africa and how we come to where we are today. So Sherly has mentioned in her report about the 2017 global report that FIP has published. And in the next two slides, I just briefly want to explain the change that we've seen since 2017. So firstly, I want to just share with you how it changed the number of pharmacies that we have in South Africa. So typically you will see under community pharmacies that in the past few years, we quite have a significant increase, almost a 25% increase in community pharmacies. So that includes pharmacies that's within a corporate setting, pharmacies that works as on a courier basis or a distance delivery system, or then pharmacies that are independently owned. Then on the next slide, similarly, I'm going to compare the status or the results of pharmacy support personnel. So in the 2017 report, it was only included the qualified pharmacist assistant basic and qualified pharmacist assistant post basic. And even just for those two categories, you can see the significant increase as those basics move on to become post basics. What was not included in the 2017 report is also the number of learners, which is when our colleagues are still training to become a pharmacist assistant. So if I can highlight firstly for you as we move forward in terms of the pharmacy assistants. So they have been around in South Africa since 1987. That was when the first curriculum was introduced. That was then reviewed in 2000, again in 2008. So you might ask me, so where is the pharmacy technicians in all of this? So from here moving forward, during the 2017 report, we couldn't report on any pharmacy technicians because we didn't have any registered. So to give you some background and to give you context on the rest of my presentation is that the cadre of pharmacy technician was published for comment the first time in 2011, which is 13 years ago. Then a lot of things happened. It was very delayed. And so it happens that in 2019, it was again published for comment. So that is why in 2017, there were then no pharmacy technicians to report on. So in terms of the legislation framework, which I would like to highlight next, what happened in the meantime, is that in 2017, as you can remember from the previous slide, we only had pharmacists assistant basic and post basics. They were the only recognized pharmacy support personnel. However, also in the 2017 report, it was reported that although common legislation was only out for comment at that stage, there was a provider that commenced with training. They called it pharmacy technicians. In the qualification authority documents, it was actually an advanced certificate for pharmacy technical support, and that they had their first graduates in 2014, as well as in 2015. However, moving forward to 2024, and this is maybe currently the only success story that I have to share with you, is that those regulations that was published for comment in 2011 for the first time finally got published for implementation in April and June 24. And this includes 3 very important documents, which is firstly the regulations relating to the practice of pharmacy. So that defined the scope of the healthcare worker. The second one is regulations relating to the registration of persons and the maintenance of registers. That talks to the competency framework of the registered person. And then the last one is the regulations relating to pharmacy education and training. And that gives us the accreditation criteria against which training programs will be evaluated and measured. The second success story, or the second phase, is then that we are phasing out that third curriculum that was implemented in 2008. So the last date for enrollment was already the 30th of June 2024. So we are now in this transition period where we end off that third curriculum for pharmacy assistants, basic and post-basic. And we've got the legislative framework for this new cadre that will include still basics and post-basics, but also then the pharmacy technician. And within then this new development, we will then have a diploma for the first time, as well as an occupational certificate. And as I said, it will be a pharmacist assistant basic, post-basic, and pharmacy technician. And that is what pharmacy support personnel in South Africa consists of. So in my next slide, without going in too much detail, I just want to give you a brief overview of the training options for pharmacy support personnel in South Africa. So maybe the easiest one to explain is the diploma. And it is on a National Qualification Framework 6, which means it's on the same level as a second year for a university student. And this diploma can only be offered by higher education and training institutions. And it is the quality assurance is done by the Council of Higher Education. It is a 2-year full-time academic program, followed by a 6-month traineeship. And then at the end, you will write external integrated summative assessment, and you will then be a pharmacy technician. In other words, from day 1 in year 1 until the last day of the 2.5 years, that's the process to get you from a school graduate to a pharmacy technician. Then to explain to you the other option that is also part of the game is to study through to do an occupational certificate. So as we move forward to the next option. So this occupational certificate is then not offered by universities, but it's offered by skills development providers. And this quality assurance is done by the Quality Council for Trades and Occupations. And the main difference here is that someone can come in day 1 and they can do the first 6-month part-time training towards becoming a pharmacist assistant basic. If they are satisfied with that role, they could write the ASA test and they could exit and work as a basic. Or they can move forward, they continue another 12 months to become a pharmacist assistant post-basic. They write the ASA test. Either they can exit if they want to work as a pharmacist assistant post-basic, or the third part, they can continue and study another 18 months and become a pharmacy technician. And then of which they will also write the ASA test at the end. So although all of this sounds very beautiful and amazing, and we are very happy that actually for this year, South Africa can fully participate in Pharmacy Technicians Day, we do have our own set of key challenges and opportunities that I would like to share with you. In terms of challenges, I've mentioned to you that our legislation was recently published for implementation. So that's very nice. But what must follow next is that there must be actually providers, so both universities as well as skills development providers that are accredited to offer this pharmacy technician qualification, and also submit the program, the qualification for accreditation and approval. And this is done by the South African Pharmacy Council. Then the second challenge is that because of the diploma and the diploma sitting in a higher education institution, it has a certain set of higher entry level requirements for someone to enter into a university qualification. But the same admission requirements is also applicable to the QCTO qualification, which actually make it very difficult for people to enter in that qualification specifically. Adding to this is that skills development providers who are offering the occupational certificate qualification are now forced to have the same infrastructure as the higher education institutions, because it's the same qualification being offered. And then I think what most of the countries around the world struggles with is that we now have a new cadre of human capital that we need to adopt into organizational structure. So within the hierarchy of healthcare professionals, and also in the creation of jobs and specific roles in the healthcare system. And then last but not least, unfortunately, previously the assistant or the pharmacy support personnel learner were working or employed by a pharmacy while they were studying part-time. And a lot of the training were done by the pharmacy in the pharmacy setting, supervised by the tutor. With this new qualification, the learner it's not compulsory or mandatory for the learner to work in a pharmacy. They can work wherever they want. So a lot of the responsibility in terms of training has now shifted to the training provider, whether the university or the skills development provider. And this increased the tuition fees significantly because they have to pick up a bigger role to play. On the other hand, some of the opportunities is that there is an extended scope of practice. In other words, pharmacy technicians in South Africa, for instance, can supervise the other pharmacy support personnel, and they can, for instance, offer technical support during screening tests, which cannot be done by the other two cadres of pharmacy support personnel. They were specifically created to work in specific scenarios and circumstances under indirect supervision, and they were also created with a very strong focus to work in the manufacturing setting as well as in the primary healthcare setting. So to end off my presentation, some lessons learned or best practices that I can share today, and that would start with that the first step is that you need to wait for that published legislation before you can start do anything, because that legislation creates the framework for the scope of practice, the competency standard, and the accreditation criteria. So although we did train what we then call pharmacy technicians in 2014 and 2015, at some point it was stopped because these three documents were not in place. So students were done with studies and find themselves without employment because there's no scope for them to work in. That is also important that once you have those documents, now the process can follow of accreditation for providers and qualifications. And then the third thing that must follow is also acknowledgement of this cadre within the labor hierarchy. In other words, in the creating of posts. So thank you very much, colleagues, for this opportunity. I've highlighted a few references. And I'm looking forward to the Q&A session. And I hope I provided you with some insight on the situation here in South Africa. Thank you very much, Ryan. Back to you.
Mariet, thank you so much. That was really interesting. I know here in the United States, we have a very different framework. And so it was really interesting to hear how things work in South Africa and perhaps some lessons that we can take back for here in the United States. So with that, I'll introduce our final speaker for this portion of today's session, Pic Yi Hui. So Pic Yi is the pioneering head of pharmacy at Alexandra Hospital, where she has spearheaded the growth and development of pharmacy services over the past 6 years. Pic Yi established the pharmacy department from the ground up. She hired and trained staff, implemented robust operations, and worked closely with stakeholders across the hospital to integrate pharmacy services into multidisciplinary care teams. Under Pic Yi's visionary leadership, the pharmacy has expanded from a dispensary model to a patient-centered clinical service. She led the implementation of pharmacist-led clinics for anticoagulation, diabetes, geriatric medicine management, and osteoporosis care, enabling pharmacists to optimize medication regimens and improve outcomes for patients. The success of these clinics paved the way for pharmacists to collaborate as key members of the care team in Alexandra Hospital. Pic Yi is a passionate advocate for empowering pharmacists to chart their career growth and make greater contributions to patient care. In addition to her responsibilities at the hospital, Pic Yi lends her expertise to shape pharmacy at the national level. She is currently serving as chairperson of the Ministry of Health's Talent Development Committee for Pharmacy Technicians, which aims to strengthen competency development and create career advancement opportunity pathways for pharmacy technicians. She is also a committee member of the Pharmacy Leadership Development Committee, which aims to develop a pharmacy leadership development strategy which articulates leadership skills and opportunities for the development of individuals and future pharmacy leaders. Pic Yi is also a long-standing member of the Pharmaceutical Society of Singapore since 2016. So Pic Yi, I'll turn it over to you to share your expertise with us.
Hi, good afternoon, good evening, and to all the pharmacy technicians, happy World Pharmacy Technician Day. So today I will be sharing on the career progression and development of pharmacy technicians. Next slide, please. Okay, let me first share a bit of pharmacy technicians in Singapore. So in Singapore, we have approximately 1,500 pharmacy technicians. 2 out of 3 pharmacy technicians work in hospitals. Our pharmacy technicians work under the supervisions of registered pharmacists. They assist in pharmacy activities that do not require professional judgment of a pharmacist. In 2014, we have expanded into 4 key areas for our senior pharmacy technicians. So these 4 key areas are patient care services, which is in the dispensary service, medication management, and patient educations. Our senior pharmacy technicians are also involved in the training and educations of the pharmacy technicians. In terms of technical services, senior technicians are also involved in sterile and non-sterile manufacturing, clinical trial drug supply. In terms of distribution service, our technicians are involved in procurement, store management and distribution, pharmacy automation and informatic technology. In terms of quality assurance services, our technicians are also involved in overseeing unit dose repackaging and quality control to support the automation, and involved in medication activities such as monitoring and tracking of near misses. Next slide, please. So what are our challenges in Singapore? So in healthcare, our challenges are not unique, but to say it in a typical Singaporean way, it means we have 3 not enough. Money not enough, people not enough, and caregivers also not enough. Singapore's expenditure on healthcare is 4.5% of GDP, but the number is rapidly rising due to aging population, rising demand or expectations from public, and introductions of new medical technologies and drugs. As Singapore's birth rate is low, manpower issue is a challenge across sectors. This is also the reason why there are weakening of family as caregivers. Hence, There are ongoing initiatives by the ministry to transform our healthcare system. Next slide, please. So in Singapore, manpower will never be enough. In 2030, an estimated 1 in 4 Singaporean citizens will be aged 65 and above. For every senior above 65 years old, there will be 2.7 working adults in the population. Specifically for pharmacy technicians, we have a workforce that is very young and driven to pursue higher qualifications. Approximately 1 in 5 technicians left their job to pursue higher education. Next slide, please. So, to supplement our current source of pharmacy technicians from the 5 polytechnics in Singapore, we have an upskilling program organized by Pharmaceutical Society of Singapore that certifies pharmacy assistants, preparing them for advancement to pharmacy technician positions. And in March 2023, after thorough assessment and review with relevant stakeholders, we have also now recognized this part-time diploma in applied science by Republic Polytechnic with an addition of 20 weeks entry to practice training. I'll share a little bit more on entry to practice training later on. Next slide, please. As pharmacies continue to automate their processes, technicians play a crucial role in managing and troubleshooting automated dispensing systems, robotics, and other technological advancement. So adoption of robotic process automation that does repetitive job, allowing pharmacy technicians to focus on higher value work. Adoptions of automation in pharmacy has also enabled pharmacy technicians to optimize packing processes and improve efficiency. Next slide. Sorry, next. So in Singapore, the National Pharmacy Strategy was introduced in 2015 as a holistic approach that is aligned with healthcare system shift to overcome the challenges faced. There are 5 key thrusts, namely pharmaceutical care excellence, with the aim to enhance pharmacy services that bring health and value of everyone in our community. Build a confident pharmacy workforce with the aim to provide a skilled, future-ready, and innovative pharmacy workforce. Redesign supply chain to provide seamless, convenient, accessible, affordable, and safe medication at every point of care. Information enablement to empower people to get the best out of their medication and achieve care goals. And technology enablement to deliver seamless and effective transition of care setting through technology as an enabler. Among all 5 key initiatives, building a confident pharmacy workforce is the key driver for all other initiatives. Next slide. Sorry, this is quite a busy slide. Okay, so let me go through this slowly. Okay, so training and development of our pharmacy technician workforce is important. The visions of success is to develop confident pharmacy technicians who can meet the benchmark competency standard at entry to practice. So to achieve this vision, a strong coalition of educators from schools and trainers from healthcare institutions, known as the Training and Development Committee, led by Ministry, was formed to ensure the curriculum and assessment strategies of healthcare and schools are aligned. So for students, this framework aims to help them to be more job ready upon graduations. Entry to practice competency assessment framework with a suite of assessment tools was developed and published in 2016 to enable change. Since its implementation in 2022, 373 polytechnic students have completed the entry to practice competency assessment framework. To enable pharmacy technicians to take on expanded roles and earn and learn advanced diploma in pharmaceutical science was introduced in 2017 through a collaboration with Nanyang Polytechnic. Till date, over 100 pharmacy technicians have graduated from this program. To build on the change, Chief Pharmacy Office at MOH engages pharmacy technician leaders regularly since October 2019. The purpose of having such leadership conversations is to allow pharmacy technician leaders to be developed through sharing of best practices related to pharmacy and also to facilitate cross-learning. As a result, the Pharmacy Technician Community of Practice led by pharmacy technician leaders was launched in July 2022. The PTCOP creates learning opportunities, cross-sharing of best practices, and garner recognitions. Since the launch, members are connected through PTCOP Telegram channel, Pharmacy Technician Day virtual celebration, and webinar. And in fact, we just had our live celebration last Saturday. Next slide, please. Next slide. Oh, sorry. So for the focus for this 2020 year, firstly, we're going to be focusing on strengthening pharmacy technician competency development, which is crucial to equip our pharmacy technicians with the skills needed as our healthcare system continue to evolve. We have published the first training roadmap in pharmacy service in August 24 this year. And we are co-creating the pharmacy technician developmental framework with key stakeholders. In fact, we are going to have a workshop tomorrow. Second is enhancing the implementations of pharmacy technician career development pathway by monitoring progress and formulating changes through pharmacy technician surveys. Third is to improve the recognitions of pharmacy technicians, increasing awareness of the roles of pharmacy technicians working collaboratively with pharmacists. You can actually scan the QR code to watch the videos of pharmacy technicians in actions with our pharmacists. So this is the first series. The focus is mainly on pharmacy automations, how the pharmacist technicians and our automation pharmacists work collaboratively together. Lastly, ensuring a smooth transitions from school to workplace through PTETP, entry to practice, which is an assessment framework. And we have actually since completed 2 trainers workshops. So basically this ETP assessment is done in healthcare institution as well as at the retail pharmacy, where this group of students do comes for their internship for 20 weeks of internship. Next slide. So the progress of national initiative is tracked and feedbacks are gathered regularly through national surveys or focus group discussions to monitor progress and provide directions for more changes. In 2022, the Farm Force initiative was set up to safeguard wellness and maintain resilience for pharmacy workforce in the patient care setting. 5 work streams were set up to focus on key areas, including leadership development, roles and scope of practice, manpower development and recognition, workload and work environment, and finally, communication and engagement. As the pharmacy journey continues, the pharmacy workforce, the Farm Force initiative provides avenue for pharmacy leaders to influence change and position the pharmacy workforce as caring partners who are accessible, ready, and motivated to forge ahead with resilience anchored on a strong core of professional excellence. Next slide, please. Here are some Here are some success stories, and there are many more. So we have pharmacy technicians in ambulatory care setting, performing POCT testing and providing patient education on coagul check device and manage phone inquiries. We have pharmacy technicians providing specialized counseling, such as osteoporosis counseling and smoking cessation counseling. And with the adoptions of technology and automation, our teams of automation pharmacy technicians have grown tremendously, supporting both inpatient and outpatient pharmacy automations. And in the community, we do have pharmacy technicians who are heavily involved in various community events to provide public educations. And next slide. And finally, what are some of the good practices that we have adopted? So we have adopted collaborative model of having committees like the Ministry-led Pharmacy Technicians Training and Development Committee, where members from various institutions and sectors came together to drive progress, engage international experts through the FIP platforms. So Ms. Susan James was invited as a visiting expert to provide guidance in pharmacy technician workforce development, continual engagements with the pharmacy workforce through various approaches and platforms to keep tab on the developmental needs. Yeah. Thank you.
Thank you so much, Picky. It was really good to hear the perspective from your part of the world. And again, I think there's a lot to learn for all of us to learn in terms of what we may be able to implement in our own countries based on what you've learned through your experience. So at this time, we have about 10 minutes for Q&A before we transition to the second session of the day. And so if you have questions for any of our speakers, I would encourage you at this time to enter them into the Q&A box so that we can have our speakers address them. And what I'll do here is I'll stop sharing my screen and ask the speakers from this session to please join on camera so that way we can have a bit of a conversation here in the last few minutes before we transition. And I'll give everyone just a moment to get back on camera. All right. Well, so we do have a question here, and I believe, Mariet, this one would be for you, which is, what does it take to practice in South Africa, however much you've not been studying from there? So I think this may be, if you're not living in South Africa, what might be the pathway to becoming a pharmacy technician there?
Thank you so much, Ryan, and thank you to the colleague for the question as well. So to give you the detail on to become a pharmacy technician in South Africa, if you, let me say, a foreigner, if you've studied foreign or abroad, not in South Africa, I'm not 100% sure, but I can explain to you the basis of how it works if a pharmacist wants to come and work in South Africa. So typically and I believe it's the same all over the world. So you will apply, or you will engage with the Pharmacy Council, in this case, the South African Pharmacy Council. You will apply to be recognized as a foreign graduate, whether it's then a pharmacist or then a technician in your case. They will vet the curriculum that you've studied to see how it aligns with the curriculum in South Africa. Then if it's approved, if there's similarities or the similarities is, above the threshold, there for pharmacists, then there's normally professional exams that needs to be written, understanding the pharmacology, understanding pharmacy practice, understanding the law. So I will assume it's the same for technicians, that you must also maybe write the ISA, but also with legislation in the South African context. And then for pharmacists, you either then have to do a 6 or a 12 months internship. So I can imagine for technicians that traineeship of 6 months, you will still have to do that as well. And then only after that, if you've passed all those things, you will then be registered as that health professional in South Africa.
Thank you very much. That's a very helpful answer. I did see that Lyane was able to join us here virtually for the Q&A portion, so thank you so much for being here. I did want to ask you a question related to AI that you sort of touched on in your portion of the presentation, which is, if you think 10 years from now, related to pharmacy technician education, pharmacy technician practice, what do you see as the role of AI a decade from now? Is there anything that we should be on the lookout for?
Can you guys hear me okay? I'm in an airport.
We
so
can.
It might be a bit loud in the background. Okay. I see it as really something that will help the technicians just perform better at their tasks and reduce the amount of decision overload that they have in the day. That a lot of things will be specialized and technicians will be there to just kind of audit the processes, prescriptions, hospital, depending on the pharmacy itself. But honestly, with the way technology is adapted, I would be surprised if in 10 years it would actually be that efficiently integrated into the systems. I'm speaking for Canada, so I'm not sure if it's quicker for adoption in other spots, but in Canada, everything's kind of slow to when there's new technology that comes out to really implement that. But I really see it as technicians being, having to deal with less decisions at the same time and having a tool that will actually help with the actual decision process. So having an automated system that will actually prioritize for you so that the technician isn't having to prioritize the tasks. So things like this, which will actually just simplify the role of the technician. So there's a bit less of a decision fatigue at the end of the day. But that's just an opinion. So
Yeah, thank you. Yeah, I think it is a guessing game for many of us in terms of what the future may hold as it relates to AI. We're seeing a lot of that here in the States as well, as far as automation and technology really playing a much bigger role in pharmacy practice than it has even in the last 5 years. Picky, I do have a question for you. I was wondering if you could speak to what you all see as the future of pharmacy technician practice. Is there anything on the horizon that will be very different for pharmacy technicians as you look to the future?
I think for us would likely be like we are slowly expanding the scopes of pharmacy. So in the space of like training and development. So in Singapore, most of the training and developments are mostly done by pharmacists, but with the introductions of like ETP, foundation training roadmaps and things like that, right? So we foresee like this would be like the future roles for our pharmacy technicians that they can play, they can actually focus in and play an vital roles in that, as well as in the realm of automations. So in Singapore, we rely heavily on automations. So most of our pharmacy technicians are already like leading some of those satellites, like in terms of like unit dose repackaging, in troubleshooting the automation machines, as well as in manufacturing those unit doses. So as for generative AI, so right now we are still in the POC stage. So we are still testing currently because we are on Epic systems. So we have not really integrate like generative AIs to our healthcare system yet. So it's more of like a standalone. So it's really POC. So we are exploring like pharmacy technicians supporting pharmacies in like medication reconciliations, and how generative AI can also help us to make medication reconciliation more seamlessly.
Thank you. I appreciate that, Picky. So in the last 1 minute here, I'd like to ask Sherly and Nisa just a quick question. You mentioned at the end of your presentation that in November, there will be some additional surveying that is done. Could you maybe just speak to, is there an opportunity for people here to participate? Will that just go to specific individuals within the countries? How will that work?
Thank you so much, Ryan, for that question. So I will let also Nisa to add to my answer for this. So, but generally, the survey will aim. We will share the survey to our member organizations and some of the organization of pharmacy technicians as well. But we are also welcome if, for example, audience today would like to share that information about pharmacy technician. Perhaps they have some data available. They can also share it by sending to our emails observatory@fit.org. Of course, we would like them to also share where the information or data come from. And if, for example, they would like to be involved in our survey further, they can also ask any questions to observatory@fit.org as well. Nisa, would you want to add to that? Thank you.
Thank you, Sherly, and thank you, Ryan, for the question. I think Sherly has already covered everything. Yeah, so there's nothing much to add, but just please note that in the coming weeks, so 4th of November to be exact, then we will send out an invitation to member organizations. And then please, we will need you to confirm first that you're willing to participate in the study, and then we will send out the survey. But as Sherly mentioned, if any of you is interested in the study, and if you have any questions about the upcoming survey, then please feel free to leave a message by email.
Well, I want to again thank Nisa, Sherly, Picky, Mariet, and Lyane for sharing your expertise with us today. I know I certainly learned a lot. I hope everyone listening now or in the future of the recording has learned a lot as well. And so thanks again for your time. Now we will transition to our second session of the day. And so I'd like to welcome Peter, who will introduce himself and lead the second session of today's symposium. Peter. And I do know Peter was having some technical difficulty, so we'll give him just a moment to see if he's able to join us. And if not, I will jump in to introduce the next session. So let's see. All right. Well, Peter, I'm going to go ahead. I'm not sure if you can hear us. I see that you're still on. I will go ahead and introduce you and the next session. And if you're able to jump in at some point to introduce the speakers, we'll welcome you to do that. So Peter Karegwa, who is the moderator for this next session, is a registered pharmaceutical technologist by Pharmacy and Poisons Board in Kenya. He holds a diploma in pharmaceutical technology from Mount Kenya University, a bachelor's degree in finance and management science from Strathmore University in Kenya. He's an honorary member of the Kenya Pharmaceutical Association and is currently serving as the national chairman of the Kenya National Union of Pharmaceutical Technologists. So Peter, we appreciate you being here with us today. I'm excited about this next session because we're going to get to hear from 3 pharmacy technicians who have unique and specialized roles within the healthcare system. And through this session, we hope that you'll gain some insight into the expanding scope of practice for pharmacy technicians, as well as some of the emerging opportunities. And I think as we learned in the previous section, or the previous session, also the impact of the regulatory differences on the profession in terms of the education and training that's required to become a pharmacy technician or a pharmacist assistant in certain countries, as well as the impact that that has on what pharmacy technicians are able to do in practice on a day-to-day basis. So like the last session, we have 3 learning objectives for this one as well. The first is to identify and compare the roles and responsibilities of pharmacy technicians in different countries and healthcare systems. We'll explore opportunities for specialization within the pharmacy technician profession. And finally, understand how regulatory differences influence the scope of practice for pharmacy technicians in various regions. As I mentioned, we have 3 excellent speakers who will be sharing their experience and expertise with us today. And for our first speaker, I'm really pleased to introduce Julie Lanza. Julie is the Director of Training and Education for Beth Israel Lahey Health System in Boston, Massachusetts, here in the United States. Her 27 years of experience involve many areas of pharmacy, including leadership operations, 340B, sterile products, oncology, and regulatory and compliance. Recently finishing a 6-year appointment on the Massachusetts Board of Registration in Pharmacy, she feels honored to have been part of something that was able to expand and advance some areas of practice for technicians over those years. Julie is active within many professional organizations here in the United States, the National Association of Boards of Pharmacy, the American Pharmacists Association, the Pharmacy Technician Certification Board, the Pharmacy Technician Educators Council, and the American Society of Health System Pharmacists, as well as her local state organizations. Julie is passionate and dedicated to training, educating, supporting, advancing, advocating, and mentoring pharmacy technicians looking to develop and advance in their career. However, she is equally passionate about educating the entire profession about the integral role pharmacy technicians have in the overall scope of practice. So Julie, thank you for being here with us. The floor is yours.
Thank you, Ryan. Can you hear me okay?
Yes, we can.
Okay. Good morning, everybody. Well, morning here in Boston, but good morning, everybody, and happy Pharmacy Technician Day. I am very happy to be here. As Ryan said, my name is Julie Lanza, and I am currently the Director of Training and Education here in Boston, Massachusetts. And I am going to talk about the unique role I have and how I got here. Ryan, do you have my slide, please? Thank you. I'm going to talk a little bit about my current role, and that is the Director of Training and Education for a large health system here in Boston and outside of the region. Currently, the health system I work for encompasses Eastern Massachusetts and Southern New Hampshire. It does encompass 14 hospitals, 3 of which are major medical centers, level 1 trauma centers, and 11 community hospitals. 5 community or retail pharmacies, and 1 specialty pharmacy. This is a newer role to my health system, as this is a newer health system in Massachusetts. We are only 5 years old. My primary role was the director to develop and implement a pharmacy technician and training program. I'm sure it is everywhere, but here in the United States, we do have a national shortage of pharmacy technicians. And with this role, I was tasked with developing, implementing a training program where we were to take people with 0 healthcare experience or recruit people who had interest in being a pharmacy technician, educate, train, and turn them into, here in the United States, nationally certified pharmacy technicians. We have been live with that program for about 1.5 years. So throughout the entire health system, in all 14 hospitals and 6 community and specialty pharmacies, we do take people from the community that have interest, and we train and educate them on site and online education concurrently. And we put them through a 6-month, very intensive training program. And in that 6 months, they go from 0 healthcare experience to a nationally certified pharmacy technician. We work very closely with Ryan and the Pharmacy Technician Certification Board to close the loop and have them nationally certified within a certain timeline. Having that resource of online training while they are working on site, they are taking what they're learning in their courses and applying it here or in whatever pharmacy we put them in. What we have seen the most success in is having them do the education while they're training on site. We have had some experience with putting them through a classroom education and then having them do some sort of externship after that. However, learning and applying it after the learning didn't seem as successful to us, so we do it at the same time. In addition to the pharmacy technician and training program, which I am very passionate about, I do get to work with the current technicians within the health system on technician advancement. Here in the United States, we do have a lot of opportunity for expanded scopes of practice, technician advanced roles. We work with a lot of educational resources through PTCB and ASHP. We have technicians obtain sterile product certification, their hazardous drug management. The Pharmacy Technician Certification Board here has 11 or 12 advanced base certifications. We work with existing technicians to grow their career. We like to, in my health system, have subject matter experts. We do like to have people all encompassing with their knowledge, but we do like to have subject matter experts because they feel more valued in their area of work. It also allows us to build career paths, career ladders, career advancements, additional roles, advanced roles. It just allows a broader scope for us to retain the current population of technicians we have. In addition to the actual training and education that I do, the health system that I work for is extremely supportive of technician advancement, extremely supportive of technician growth. So I do get to be involved with a lot of controlled substance and narcotic education, a lot of sterile compounding education, as well as writing a lot of regulatory policies and procedures. The uniqueness of my role, I will say I'm very fortunate and privileged to have, because it allows me to still be involved in a lot of areas of pharmacy where I'm not siloed into one section. I do still have the opportunity to practice as a pharmacy technician, where I'm allowed to make IVs or fill an automated dispensing cabinet, where I do get to participate in the day-to-day responsibilities of a technician. There are a lot more. I did not list all of the responsibilities in my role, but the primary roles are listed here. Essentially, I have the privilege of taking 500 to 600 technicians and training and educating them into any role that they want. I will say that part of my role, and probably the most important part of this to me, is the mentoring portion of this. When I became a pharmacy technician 27 years ago, I think we talk a lot about how this was a job 27 years ago, and now this is a career path here in the United States. And I think mentoring technicians, younger technicians, into learning how to build a career on something from the very beginning, and how to mentor them and teach them and educate them and build on what they started, is probably the most rewarding part of my job. So I think that, you know, the training and education piece is very important to me, but I think the mentoring part of it, and I attribute the paying it back because I had some very good mentors. But I also would say that my current employer is probably a big part of why I have this unique role. Next slide, Ryan. And I think a little bit about how I got where I am is probably a good explanation about, well, this is a good explanation of how I got where I am. I did start in 1997 in the community pharmacy. However, since 1999, I have been with the same employer that I am with now, just in a lot of different roles. I did start in institutional pharmacy, hospital pharmacy, you know, I want to say in a traditional fashion, just kind of worked my way up from there as a lead technician, went over to some sort of compliance-based role, turned into a pharmacy technician manager. And, you know, about 2 years ago, I took the role as a director of training and education. I will say that I don't know what it's like other places. For a technician to be a director level in a health system in the United States is not very common. There are not many of us. We do talk a lot. There's a network of us. It is not a very common role. So again, I will say I'm very fortunate with the employer I have that's very supportive of pharmacy technicians. I will also say that unique roles are based on other experience aside professional experience. I have my 6 years on the Massachusetts Board of Registration in Pharmacy gave me a lot of regulatory experience in what technicians can do in scopes of practice. Here in the United States, the 50 states plus Washington, D.C. and the other Puerto Rico and the other provinces we have, technicians practice is not standard across the United States. Every state is different. Every state has different regulatory policies we have to follow, and we are not standard across the United States. So it is very confusing from one state to the other what I could do versus someone an hour away from me. But the regulatory experience I got from the Massachusetts Board of Pharmacy gave me an entire perspective on what technicians are able to do throughout this country, what we can do, what we're not doing here in my state, but what we could be doing. So it actually brought together a smaller group of us that sit on different boards of pharmacy throughout this country. And we work together to advocate for expanded roles and scopes of practices. We do work very closely with the Pharmacy Technician Certification Board and Ryan to advocate for additional technician representation on each board of pharmacy, for expanded scopes of practice, for technician advancement throughout this country. It is a challenge, but we feel like we are being heard. I think it's just something that is a continued effort, and we will continue to do that until we get to where we need to be. Like Ryan said in my bio, I am an active American Society of Health Systems Pharmacy committee member. I also do some work with the National Association of Boards of Pharmacy here in the United States as a speaker, a presenter, and a task force member. I've also been fortunate enough to work with the Pharmacy Technician Certification Board on an item writing committee, or helping to develop one of their exams. And I am currently going through the Pharmacy Leadership and Education Institute, which is in progress through December. And I added my additional experience because I feel like when I was asked to do this about my unique role, I think the Director of Training Education is a unique role and title itself. But I feel like there was a lot of my professional experiences is part of this, but I feel like the additional experience that I have got me to where I am. I feel like the leadership, the passion for leadership I have, and mentoring, and the advocacy I have. I also feel like there's other technicians around this country and around the world that feel the same way I do, that sometimes technicians, we can all do more than sometimes people want us to do, or the expansion could be more, or we could keep developing beyond where we are. And I feel like all of these things add more to where I could be. And I feel like, you know, I strive to be better. I strive to be better for the technicians that are coming up behind me. I always want to be a good leader. And I think additionally, what I can attribute to where I am is the additional education that I pursue. You know, through the Pharmacy Technician Certification Board, I am an advanced pharmacy technician, which means I have passed a certain number of the exams. I do have my sterile compounding certification. And I feel passionately that if I am going to mentor pharmacy technicians and train and educate pharmacy technicians to do something, to be something, to make something of their career, then I should be doing the same thing. I want to be able to teach them what I know. I want to be able to explain something to them, or encourage them, or support them to do something if I've done it. I don't want to not know what I'm teaching them. I feel like I have a lot of opportunities. I've been very honored to have a lot of opportunities like this one to share my experiences, but I've also been given a lot of opportunities to gain new experiences as time goes on. I tell all of my new technicians and all of the technicians that go through leadership and are starting to climb the leadership ladder, or the career path ladder, or the career ladders, to take every opportunity that is given to them, because there's always going to be something that, you know, you will learn from. I have been given countless opportunities to learn and meet new people, and listening to the people in session one is another learning experience for me. And I think, you know, learning is something that is unending, and I think it's something that people take for granted. And I think as pharmacy technicians, just like pharmacists, I think pharmacy technicians and pharmacy in general, we learn every day. It's a never ending learning career. But I think my passion lies in teaching the pharmacy technicians of tomorrow, or teaching the new ones coming up, that this is not a job. You can certainly be a pharmacy technician and go on to another career, or continue on to be a pharmacist. There's nothing wrong with that. There is enough in the world of a pharmacy technician to make a career out of this, to make a successful career out of this. I feel like we can, as a global pharmacy technician world, show the world the value in being pharmacy technicians. And there's a lot more that we could be doing together. And I feel like this is just the beginning of where we could be in the next 10 years. And I'm excited to see where we all go together. And I think that's all I have, Ryan, right? And that's it for me. Thank you.
All right, Julie, thank you very much. It was great to hear about your experience. And I think one of the things that you highlighted that we can talk about a little bit more in the Q&A is the importance of professional involvement and professional development. And when we get to the Q&A, maybe we can talk a little bit about your advice for how people can go about doing that. So thank you very much. And now I will introduce our next speaker for this portion of the session, Claire McManus. So Claire is a pharmacy technician at Trollers. And this is one of the largest specialist residential school and colleges in the UK for young people with physical disabilities aged 4 to 25 years. Around 300,000 doses of prescribed items are transcribed and administered each year. And of the student cohort, 66% have cerebral palsy. The medicines management team consists of 4 pharmacy technicians plus trainees, and they are responsible for transcribing onto electronic systems from which care staff administer. The team are integral to medicine policy and processes, safe storage, stock checks, audits, and training. The team work closely with a multidisciplinary team and contracted GP service to ensure medicine administration is personalized to students' preferences, routines, dysphagia, and clinical needs. Enteral and oral routes for medicines IDDSI levels and NUT guidance are essential considerations. So Claire, thank you for being here. I'll turn things over to you.
Thank you. So like Ryan said, my role in the UK I think is really unique, and I actually haven't met anyone else that has a very similar role. So the way I was going to talk about my role was what I do today, but as a background, I think the course in the UK can differ depending on where you what course you follow in order to register as a pharmacy technician, and the standards for professional regulation are the same across all of the courses, but your exposure to clinical situations or your exposure to the role can differ depending on whether it's what we call secondary care, which would be inside a hospital, primary care, which would be patients in the community, or my unique role that I stumbled across one day when I was looking for a challenge and looking for something different. So it can vary a lot in the UK as to what pharmacy technicians do. Next slide, please. So a bit about kind of where I work now. Trollers is a school and college in Hampshire in the UK, so it's in the south of England, and it's what we call a national non-maintained special school. So that means we don't receive funding from the government, but every student, we don't call them patients here because we're a school, so every student who attends here is funded individually depending on their individual needs. And that's by 40 local authorities across the country, so we're national. We have around 175 students who differ in age from 4 to 25 years. 100% of them use a wheelchair, and 66% their condition is cerebral palsy. We have other conditions of students with other conditions who, which would range from things such as Duchenne's muscular dystrophy. Some have genetic conditions that are very rare. So we might have 2 or 3 students with genetic conditions, but there will be the only 2 or 3 possibly in the world with those conditions. 17% of our students will have a gastrostomy, and 6% of those students will be completely nil by mouth. So a lot of our role in this setting is making sure that when students come back with medicines or with different forms or different doses of medicines, that they are safe to go via their enteral route. And a bit unique to us, and compared to other parts of the country or other roles, is we're not supervised by a pharmacist. So we are solely a pharmacy technician team, and there's almost 5 of us now who are in the role, and we are clinically supervised by a GP who is off-site. So a lot of our role is extended, but we have to make sure that we're staying within the scope of practice and within the role of which the GPHC sets out that is acceptable and okay for a pharmacy technician to do. But we have lots of external people that we can contact for support if we need it. And 32% of our students are non-verbal. So, but that doesn't, like, part of the challenge, I think, in the role, again, which is unique to us, I think, but in all jobs and in all parts of the world, you'll come across people who are nonverbal, but it doesn't mean that they don't have capacity. So any medicine changes that are being made or any medicine processes or anything that we're doing need to involve that patient or that student, because just because they're nonverbal doesn't mean that they don't have a say and shouldn't have a voice. It's more important that we're giving them that voice and finding how they can use their voice to communicate their medicine need. And we also have about 820 staff. We work in a big MDT multidisciplinary team. So we work very closely and collaborate with speech and language therapists, dietitians, physiotherapists, occupational therapists. We've got a contracted GP service. And like I said, we've got almost 5 pharmacy technicians on site. Next slide, please. So I touched on this a little bit already. We've got 4 pharmacy technicians, plus we have started in the last few years offering people to join as what we call PTPT, so the pre-registration pharmacy technicians and the training course, which is 2 years here in the UK. We found that previously, so when I started the role, it was thought that it would be a one-person role and we would manage all of the medicines for all of the students and the systems. But actually, very quickly, the role that I was employed to do has changed and developed over the time I've been here. Been here 4 years now, and we've taken on a lot more responsibility. So with that comes, we've got more staff so that we can offer a medicine service that is bespoke to these students. But we found that when we tried to employ people that had experience or had trained in a different environment, it actually was quite a difficult place for people to come in and to work. So what we did was we looked at different providers of the pharmacy technician course in the UK, and we picked one, and we've had now 2 successful trainee pharmacy technicians come through and qualify with us. Both currently are still employed by us, but it's such a unique place to work that we found like to grow our own team has been really successful for us so far. Part of our role, well, all of our role really is medicine safety. And I think when you look at specialisms within the UK for pharmacy technicians, I personally don't think it's always clear. Like when you go in to be a pharmacy technician, I don't know that right from the beginning it's very clear about the specialisms you can go into. And I think in my current role, we dip into all of like a few or quite a few of the specialisms, but don't fully specialize in any of them. So medicine safety is something you'll find across the UK as a role within a hospital. Some hospitals have pharmacists in that role, and some hospitals have started to develop the role and allow pharmacy technicians to be part of that role. But everything we do, we're doing for medicine safety. So the ITSI levels and the IDDSI levels and things are to do with the thickness of the medicine and whether it's safe for our students with their conditions to swallow it. Whether the form or even something as simple as changing the brand for a medicine can affect our students' swallow, or whether it's safe enough for that student to take it. So most of our role is making sure that we're paying attention to detail and checking that we haven't received a different brand of a medicine and that that's okay for that student, or we're checking with the correct specialism, the speech and language therapist or the dietitian, that it's okay for that student and it's safe. A recent development in our role is pharmacy technician-led clinics. So this is quite new. We've only been doing it a few months, so our students, all 175 of them, will have a prescription of medicine. They have very complex medicine regimes, and with that, because their conditions are consultant-led, and a lot of the medicine changes, if not all of them, are made by secondary care in hospitals. A lot of the systems don't currently talk to each other in the UK. So when they make a change in a hospital for a student, they then will come out with a letter or an electronic letter, and that will sometimes take a bit of time to get to us or to get to their GP, who is their primary care physician. So we need to make sure that all medicine changes are actioned in a timely manner for our students on site, so that they didn't have a medicine change in hospital that like increased their dose of Epilim or their epilepsy medicine that we then didn't know about, so we didn't action. So we found that we used to have nurses in the role, but actually 98% of things that come through our clinic are medicine changes. So in the last few months, we've made it a pharmacy technician role, and now pharmacy technicians lead that clinic and lead that medicine change and that medicine review and check. Part of that check is about medicines optimization. Like I've said, that our students have really complex medicine regimes. So we're making sure that they might just have a cream prescribed because they needed it. Their skin integrity is compromised because they're 100% of wheelchair users. So we're making sure that when we're making a change to, say, their epilim, we're also making that change and seeing, oh, they've had this cream prescribed for a year, but they haven't requested it in the previous 6 months. So are we making best use of this cream? Does it need to be reviewed by a clinician? Do we just stop it? Do we speak to parents? Do we speak to the student themselves? And kind of troubleshooting, making sure that we are optimizing each medicine for the student, no matter where it falls within that priority of epilepsy medicine or medicine for seizures, you know, making sure that we are looking at the creams and the less urgent medicines, because they're all very important for that student. And what can seem less urgent today might not be less urgent tomorrow if we haven't ensured the correct management of all of the conditions. Another big part of our role is about stock management and audits. We do all of the ordering for all of the medicines for the students, and we ensure that we complete audits weekly on every medicine that is on site. So in 12 months, we give in excess of 300,000 doses of medicine. So that's a lot of audits and that's a lot of checking. And I think, again, it's another unique part of our role that we manage all of these things. And I think in other settings, we found that when we've approached people with similar settings, not necessarily a similar role, that they have different teams and different people of the MDT that do all of these. But we found that by bringing it all into one team, the continuity from start to end just ensures the accuracy and decreases the risk of an error. We found that using original packaging of medicines rather than dosset boxes or MDS boxes has decreased the risk of errors as well, because in a dosset box or an MDS, which I think the assumption in community pharmacy possibly is that that's easier for students or patients with a disability because they pop out the time, all of the tablets are in one time frame and then they take them. But we found internally that actually that did increase our risk of having a medicine error, because if you popped out the wrong time, but you had different tablets at 8 in the morning and 8 at night, you then increase the risk of taking the wrong medicine at the wrong time and not being 100% sure of the medicine that was taken. So that was a big change during COVID, to go back to original packaging, and it stayed. We provide advice and support for the MDT. I am the lead for the team, so I'm involved in writing the policies and developing them. And I think because it's a very unique role in the very beginning of kind of our development and the development of a pharmacy technician as a whole in the UK, the legislation and the guidance isn't always readily available for what is within a pharmacy technician's scope of practice. So I think we're at a really interesting point in the UK at the moment where the development of the role is happening, and it's happening really quickly, and there's been consultations and developments and standards of practice being developed. So I think we're in a really unique, great place at the moment. Transcribing of medicine is something that we do, and again has never really been done by pharmacy technicians before, or that I'm aware of. So previously to me coming into this role 4 years ago, an external pharmacy and a pharmacist completed that role for us, but we found that by having it in-house, we can take account of student preference and wanting to make the changes effectively for the student, not saying we have to wait till 2 o'clock tomorrow for that time change to happen because you want to go swimming. So by bringing it in-house, we could implement accuracy checks, we could implement time effective changes, and we've seen a big increase in the satisfaction of our students and their parents of what we can do to manage their medicines. Because of their complex medicine regimes, it's really important that for our role to be successful, to be measured successfully, that actually we're ensuring the medicines fit around the students' lifestyle and things they want to do rather than the other way around. Next slide, please. So transcribing was defined, and this policy we only developed within the last 2 years. So again, it's still at the very beginnings of what could be developed, and there's always things to learn throughout the whole process, but it's defined as the copying of previously prescribed medicines, details to enable the administration in line with legislation. So what we did right at the beginning was, because we can't prescribe, because that's not a development or that's not a career progression for a pharmacy technician, we worked alongside an NHS trust, and we developed a approved wording policy of what, so copying of previously prescribed medicines, we didn't want to need to copy it word for word, and we wanted to copy the descriptions so that they were accurate, so they were correct and they were safe for that student. But actually we wanted a approved wording list so that for all 175 of our students it was consistent, and that was with the aim of reducing the risk of an error as well. Like I've already said, 300,000 doses of prescribed medicine each year, so the workload is really, it's really high, as it is anywhere, but there are difficulties within this role with the amount of medicines that we input onto the system. One of those is that the routes can be very different, and I think another challenge we find is the handover of care from different specialities, from secondary care, so in hospital, back to us. Our students are very clinically vulnerable, and in the winter or any time of year can end up in hospital, and they're not always familiar with seeing students with our students' presentation. So we find that a lot of our role, and a benefit of having pharmacy technicians in post, is that we go through all the paperwork. We're used to seeing it because we've had the training and we've worked in that setting previously, and we can pick out and contact the pharmacist or contact the prescribing doctor in that primary care, secondary care setting, and get to the bottom of, has this medicine been changed to the oral route purposefully? Has it been overlooked because you've not seen a student with this presentation before and you were unsure? Is it just an error? And because, errors do happen, and I think we will never be at a point where there is a zero error rate. And I think we would be worried if we thought there was zero, because we would be worried about what are we missing. When you have humans doing a job, there is always the risk of human error. And I think that's why we've worked really hard to put all of these accuracy checks in place to reduce that risk, and reduce the risk of what we call errors reaching our student and being a near miss. So we're picking them up in those accuracy checks that have been put in place for that reason. ITSE levels are to do with the thickness and to do with whether the student's got a safe swallow. And we can think, yep, we've got that right. We've spoken to speech and language therapists. We know this student can take ITSE level 3, which is thick, and you eat it with a spoon. But actually, is it safe? And that can be part of their life-limiting conditions. That can change, and it can change from morning to evening. And so part of our role is always ensuring we're checking a 24-hour picture for all of our students. NUT guidelines, I don't know if this is unique to the UK, but it's a set of guidelines that say whether medicine is appropriate to be used via an enteral tube, whether it can be crushed, whether it can be mixed with water, or it can be mixed with food, whether it shouldn't go via a gastrostomy tube or a jejunostomy tube, and then it gives you alternatives if appropriate to do so. Student needs and preferences is really important, and I think safety is always going to come first on that list. We're ensuring everything is safe, but actually, if it's safe and the student absolutely hates it, is there another safe way that we can do it that actually is enabling them to be as independent as they possibly can with their medicines? The picture is an example of some of the wording that we may have on a student's medicine record. So we use an electronic system, and that one that's included is quite a simple instruction for us. It's for dystonia management, and we try to make it as clear as possible, even with complex instructions for medicines. Next slide, please. Measuring the impact of our team can be quite difficult, and I think honestly I have to admit that since I started 4 years ago, when we've tracked trends of medicine errors, we haven't seen as big a reduction as I think we expected to. But I think when you look at it more in depth with the surveys or with the audits, it's the type of error has changed. So although the overall error rate hasn't decreased by more than 1%, the errors reaching the student and have reduced. So we might be picking up the same amount of errors, but actually they're being picked up in our accuracy checks and they're not reaching the student. So there is very little poor impact on the student. However, overall impact hasn't shown a reduction in overall errors. But what has changed is there's 100% of students have reported that they like how staff help them with their medicines. And that question was asked tailored to their communication ability. 98% of parents were satisfied that as an MDT, we meet their students' health needs all or most of the time. And 99% were clear on medicine information they needed to provide. With such a complex process for medicines, we're quite specific about what we want. We want 3 pieces of evidence before any medicine change is made on the system, and that's to ensure that all specialities are talking to each other and we're ensuring that it's safe for that student before we just say, oh, mum said the baclofen's increased to 20 mils, but actually in the complexity of someone's condition, parents sometimes don't, and not knowingly, but they don't always hear the correct information because their focus is something else, whereas our focus is the medicine, and we work really hard to take that responsibility off of parents. So we ask for it in writing from the prescriber. Errors requiring monitoring or intervention to reduce the risk of harm decreased by 5% in 22 to 23, and similarly errors causing temporary harm reduced by 1%. But as, like I've said, as an overall, we haven't seen a reduction in our overall errors, but that's quite a significant reduction in the errors reaching a student. Next slide. And thank you for listening.
Claire, thank you. That was very interesting, and it's very obvious that your role is extremely specialized, as you said in the beginning. And so I wrote down a couple of things that I want to ask you when we get to the Q&A portion. So we'll get to that in just a few minutes. I do want to encourage everyone as we transition to our third and final speaker for this session, that if you have thought of questions for Claire or for Julie and for Samuel, who will speak next, to go ahead and put those in the Q&A, and we'll get to them in a few minutes after we hear from our final speaker. So thanks again, Claire. We'll come back to you in just a bit. So it's my pleasure to introduce our final speaker for today's session, Samuel Lyane. Samuel is a clinical pharmaceutical technologist working with the Anticoagulation Clinic at Academic Model Providing Access to Healthcare, abbreviated AMPATH, Moi Teaching and Referral Hospital in Kenya. He coordinates the daily activities of the Anticoagulation Clinic, patient enrollment, drug adhering education, and experiential teaching of PharmD, B-Pharm, Masters in Clinical Pharmacy students during their rotation at the clinic. He also teaches pharmacology to Kenya Medical Training College, clinical medicine, and nursing students. He graduated with a diploma in pharmacy, a BSc in health promotion education, and is now pursuing a master's degree in public health. He worked as a medical representative with Giant Pharmaceutical Company and as a volunteer with the Kenya Red Cross Society before joining the pharmacy team at AMPATH. His interests are in clinical pharmacy thrombosis and hemostasis. He is passionate about patient care, research, and health education. So Samuel, thank you for being here. I'll turn it over to you now.
Thank you very much, Raya, for that introduction. As well noted, my name is Samuel Nyanje, working with AMPATH in Kenya, coordinating the activity of anticoagulation clinic in Kenya for patient care. It is a pleasure for me to have this opportunity to share what we do in the clinic. And being the last speaker, I have been privileged to understand and appreciate what others have been speaking about. And now this is my role, my topic today will resonate well with what I've been really saying. Next slide, please. We'll be sharing about the role of pharmacy technician in research, and from what has been explained, research is key in every aspect of life, from means, AI, innovation, from Claire last speaker, the research, and when pharmacy technicians will be involved in research, probably will improve our career progression and improve patient care. In this slide, I'll be looking at introduction, importance of research, pharmacy technician role in research and collaboration, what collaboration can do in research, and possible outcomes of researches, and then probably conclude. Next, please. As we all may understand, research is looking at the new ideas, new material, new areas, so that we can establish facts and reach out to new conclusion for betterment of healthcare and health in general. So we'll be looking at how important pharmacy technician involvement in research will be important to foster health and healthcare for patient and for the community in general. Next, please. The main role of pharmacy technicians has been to ensure medicine are dispensed in a legal way, efficient and accurate. But with changing time, we find that there's a shift to other responsibility, as Claire has clearly said. It's been rare to see a pharmacy technician leading a clinic where they are solely responsible for medicine administration. But with this responsibility change, we'll also need to look at the research implication that comes in it, because the research outcome improve the skills, the knowledge, and how we do things. So with this ever-changing world, continually improving outcome research is a key factor in this sector. We need to involve ourselves with research and pharmacy technicians so that we can improve the outcome of our care to our patient, and also share our research outcome through publication and be part and parcel of the community that improves skills and knowledge of the research and the outcome of our patient and patient care. Next, please. As we've all heard from different speakers, everybody has different idea and the way looking at things. My idea might not be the best, but when we come together as pharmacy technicians, our idea will reach and get the best idea, which come from different angles and different perspectives. As appreciating the idea of others, coming together as pharmacy technicians will come up with the best idea which can be researchable and also improve outcome in patient care. Next, please. The importance of research might come in different ways. For example, it will advance medical knowledge to both healthcare providers, patient healthcare givers, and patient alike. So when the advanced medical knowledge has been brought out from the research, will also improve critical thinking and problem solving for the researchers and pharmacy technicians for that matter, so that we can be able to be at par with the changing world and innovation that comes in the market and our workplace, so that we can improve patient care and the quality of health for our patients. It's also foster culture of inquiry. As pharmacy technicians, will also be up to the task to ask and be able to interrogate ideas and new opportunity that come, so that we can improve the healthcare outcome of our patient. Also prepares us for the future careers. For example, if you're a researcher, you are constantly having an idea that could put you in career and job opportunity as you continue gaining research skills and continue as a form of employment and also providing some knowledge and skills to you as a person and to the community in general. It also contributes to scientific advancement. The outcome that might come from the pharmacy technician, the research from either corner, from pharmacy technicians, from the researchers, from system researchers, provide scientific advancement that improve the knowledge of pharmacy technicians and ultimately improve the knowledge of the caregivers, and also improve how we handle our patients. Next, please. Pharmacy technician role can be as wide as it can be, but the few way we can be involved in pharmacy technicians, because we said everybody has their ideas. Like we heard from other speakers, everybody looks at one topic differently, one idea differently, one scenario differently. From those different ideas, we can come up with identify topics to be researched on, and also be able to improve on them, and also work on the data collection area so that we can improve the quality of data. Now that we are dealing with the patient, we are dealing with the last people to be the patient and the drugs, we can be the best person to collect the quality data needed for research. And also we can be used as pharmacy technicians, can be involved in community engagement for dissemination of the research outcome, promoting the research in the community, and also work as research assistant, working with the renowned researchers who are knowledge, idea, and expertise in research, so that we can help us acquire knowledge in research methods, so that we can improve the quality of health for our patient and client and the community at large. Next, please. Integration of research in pharmacy technicians, like bringing together different aspects of life, those different aspects of pharmacy technician ideas and opportunity and work, so that we can come as a big, strong strand that can work and remain strong for the patient's benefit and for the entire community benefit. For the research, the integrating of, like this picture shows a coming up of so many different kind of ideas, different kind of scenarios, different kind of professions that coming together to improve the healthcare provision, and also strengthening the work of pharmacy technicians, so that when we stand as a strong strand, will be better for the healthcare provider, pharmacy technician, and overall community health and our patient improvement. Next, please. This integration creates a research culture in pharmacy technician, so that we improve and be able to increase our intakes of suspicion for research topics, research ideas, and bring them on board, then provide research training for pharmacy technicians. For example, the partner community researchers, the countries that the FIP, led by the FIP, can promote research training for pharmacy technicians, so that we can be able to have the skills required to freely and confidently participate in research as pharmacy technicians. Also be instrumental if there's a resource allocated for pharmacy technicians who are willing and ready to be involved in research, so that they can feel motivated enough to have the resources available to enhance research in the pharmacy field. It's also important to appreciate the pharmacy technicians who are being involved in the research, to support them in publication, so that they can share their idea, their stories in a way that we are doing this way, like today in this presentation, but also in publication for future references and for future use. So important to recognize and reward research achievement made by pharmacy technicians and those who are involved in pharmacy technician research method development. Next, please. It is important for us to appreciate that you cannot do it alone. You need to collaborate with different partners, different people, different profession so that we can come up with the best ideas, best research outcome, and best impact that research can offer. Next, please. So collaboration is key for us to improve the research outcome. By collaborating together with other profession, other cadres, it also will leverage on complementary expertise and resources, leading to more impactful research outcome, so that when, as we discussed and realized earlier, that no one has the best idea. When we come together, we'll have my idea with your idea will be the best, then we come up with an impactful research outcome, and also promote local government agents and member state collaboration, so that what is working in Kenya, for instance, might not be the same scenario in US, not in South Africa. Coming together, we can come up with one ideal situation that can also learn from one another and also improve the research outcome. It's also important to involve partners with partnership with other research institutions that are well established, so that it can improve the aspect of research and the idea of research in pharmacy technician. Next, please. By collaborating with others, we also improve the quality of research, and also research in the same will also promote quality improvement in what we are doing in our aspect of life, will improve the quality of life of our patient, quality of life in ourselves as a career development. It's also improve and innovation and advancement in healthcare provider. It's through research that we can get the innovation like AI innovation. It's also building of research capacity. When we continuously involve ourselves in research, we can also improve our research capacity as pharmacy technician, as a pharmacy department, as a profession. It also enhances lifelong learning. As a researcher, you are continuously in books, learning, look at the new phenomena, looking at the new ideas, looking at how you can improve things, and this will always put you on toes and continue learning. With this, we'll also be able to, because what is involved in research is a lot of work, we'll also be able to give, as a pharmacy technicians, a culture of respecting and appreciating other people's work, so that we can appreciate what is being done in other fields, rather than just using it without appreciating how it came on board. Next, please. And with that, this is some of the research I've been involved in as a person, and I encourage most of pharmacy technicians who have ideas to be able to come in and appreciate one another, and also FIP to lead to lead in appreciating and allowing pharmacy technicians to be involved in research in their different own way, different own one from different countries. As I said, everything might be different from where I come from and from any other possibility. Next, please. As we look at this on different way, when from the first introduction remark from Catherine, we say we are looking at today and tomorrow, and the theme of this webinar has been working together for the future of healthcare. We cannot work together for the future of healthcare minus research. Research will give us the indicators on how to do things, how not to do things, how best we can do things, so that we can improve each other, healthcare's life, our patient outcome, our livelihood, and improve each other as every aspect of life. So if you impress research, impress the inquisitive mind, culture, research culture in pharmacy technician, I believe that we can go far as pharmacy department and specifically for pharmacy technician. Thank you for that time, and thank you for this opportunity.
Thank you, Samuel. I think it was interesting that you also mentioned lifelong learning, which is something that Julie mentioned in her presentation too. So during the Q&A, maybe we can focus on that a little bit as well. So just like our previous session at this time, if you have questions for Samuel, Julie, or Claire, I would encourage you to enter those into the Q&A box on your screen, and we'll address them as we get them. I'm also going to stop sharing my screen and ask for Samuel, Julie, and Claire to join back on camera so that we can have a conversation. Thanks, everyone. So one of the things that I wanted to ask, maybe we'll start with Julie, actually. Julie, you mentioned outside of the job that you have as Director of Education and Training, that professional involvement and development is also really important. Do you have any advice for people who are listening in terms of how they should go about getting involved in organizations where they live?
So I can give them the advice that I have here. I don't know if, so in simple terms, I have in the United States, we have Ryan, we have the PTCB, we have the Pharmacy Technician Certification Board here in the United States. I don't know what the equivalent of that would be in other countries. Getting involved in professional organizations is as simple as just reaching out to emailing or reaching out to one person and asking them how to get involved. It starts with that. I think that you can do it here in Massachusetts. We can start on the local level, but nationally, it's just looking for one resource and building upon that. I think that a lot of people think that they have a lot of ideas on how to expand technician scope or advance technician scope, and the ideas are grandiose or they're very far in the future. And we know that we can't do that all at once. And it's a marathon, not a sprint. So I think you need to start very small and build upon that. And I think if you in your region or your country have a professional organization that's equivalent to what the PTCB is here in the United States, it's just reaching out to them and asking them how to get involved. And if you don't want to be involved with them, they can give you local resources probably on how to get involved in that way. I will say that for me professionally, aside from my job and my career, the professional organizations have given me just as much advancement and fulfillment as my actual career itself. So I would say that getting involved with them little by little by little, and one door opens another door, opens another door, and the more opportunities that you take, the more opportunities are offered. So that would be my advice.
Thanks, Julie. I do see there's another question for Julie in the Q&A. We'll circle back. I'm going to ask Claire the next question. Julie will come back to you for the other question that's in the chat there. Claire, you mentioned a lot sort of about how specialized your role is. And in the spirit of lifelong learning, I'm wondering how you learned that. I mean, was this mostly on the job training? Were there any specific courses available in the UK for others who might be interested in this type of role?
So I think I have a bit of a unique background. So personally, my professional background, I was a nurse previous to being a pharmacy technician. So I think for me, when I did my training, I always knew that working traditionally in a pharmacy in the UK probably wasn't what I wanted to do, but I wanted to do the pharmacy technician course to then go on to do something else. So I think personally, I have a little bit of a different background to necessarily some other people, but professionally, there are courses that you can do post-registration. So our pharmacy technician course is a level 3 course in the UK, and now it's also an apprenticeship. So it's really accessible no matter your academic background, and it's a lot of on-the-job learning. And I think that works really well. Being accessible, you're going to get more people in, and lifelong learning, you can learn on the job. I think going forward, there are more clinical courses you can do. And currently I'm studying for a level 4 course in clinical pharmacy. It's a clinical pharmacy diploma. I'm nearly finished, but that also exists here in the UK. But I think for me, for my specialized role, we've built it from the beginning. So I think a lot of it has been learning on the ground. I think that is traditional across the UK for specialised roles. Is they are developed by the we have something called the APT UK, which is the Association of Pharmacy Technicians in the UK, and so a lot of development is through them and through legislation. But actually, on the job learning for specialised roles is, in my experience, has been very individual and a lot of learning on the job.
Thank you for sharing that. I'm going to ask Samuel a question. One of the things, Samuel, that you mentioned in your presentation, you mentioned the importance of collaboration when it comes to research. And you mentioned on one of your slides about finding partners to work with on that research. Can you share a little bit about, in your experience, how you went about finding those partners to work with on research?
Thank you very much for that question. My key support has been in the clinic, the exploration clinic. We've been having those students who are rotating in the clinic, the pharmacy student, the pharmacy student, when they're working on their work, their thesis and their clinical work. And for example, the idea that come from the clinic, we normally incorporate our staff that work in the clinic, and that is the key partnership, the part of school, university, like Moi University, Nairobi University, and Purdue University has been a partner in our collaboration. The other thing has been the hospital itself. It has been a partner. For example, AMPAC works as a same NGO, same private, public partnership. So that partner that has brought in the partnership, the private partnership, the NGO partnership, and the government has been important for us to partner and foster the research aspect in our pharmacy technician. Thank you.
Thank you, Samuel. Yeah, and we see that here in the United States as well in terms of government partners or professional organizations, as well as having students that are on rotation a lot of times to help engage in some of the work of the research. So we'll circle back here to Julie. Julie, and I can answer part of this question, but you describe pharmacy technicians as a career path and not a job. Why so?
Okay. So I guess I'll explain more so from our perspective here in the United States. Historically speaking, pharmacy technician was a stopover to something else in the healthcare profession. And this, I'm talking years ago, 20 years ago. Being a pharmacy technician was a temporary stopover to nursing school or pharmacy school or something else in the medical field. It was something to get your feet wet into anything in the healthcare profession. And that was primarily because, again, here in the United States, there wasn't a lot of growth in the career. There wasn't a lot of expansion. There wasn't a lot more than just your basic medication delivery or handing out prescriptions in the community pharmacy. Since that, and more so here, since about 2013, 2015, our career and our profession has expanded exponentially. With the addition of advanced certifications, with each state locally, nationally expanding regulatory practices and policies, technicians, they're allowed to do more. They can do more. Up until a handful of years ago, technicians were not allowed to immunize in the United States, and now there's a lot of states that they can do it. So as the years have gone on, the technician scope of practice has expanded to where you can build a career upon this. They can be, there's probably, I could name about 24 different areas of pharmacy that technicians can build a career in. But realistically speaking, when I started, and even in the early 2000s, this was primarily, and I guess I'll defer to Ryan to agree or disagree, but this was primarily a stopover to something where they were going into a higher level healthcare profession. And now that it has become something where they can build and make a career out of it, we see a lot more people and a lot more educators, but a lot more employers building career ladders and career paths. You start as an entry-level technician, and then a Tech 2, a Tech 3, a lead, a supervisor, a manager. And these all come with additional certifications, expanded scopes, expanded responsibilities. So it's not a bad thing that it was a job. I don't mean to say that it was a bad thing that it was a job 20 years ago. I just think that historically speaking, it was a stopover and not something anybody really could or wanted or thought they could do for the rest of their life long term. And now it's something that here in the United States we have built into a career and something where a technician can be extremely successful long term for a long term career. And you can talk about the item writing, right?
Yeah, I very much agree with what Julie has shared. And I think a lot of it has evolved in part because of the COVID-19 pandemic. Immunization administration is a great example that Julie shared, where prior to the pandemic here in the United States, it was very rare for pharmacy technicians to be engaged in immunization administration. And the pandemic sort of forced that to happen in a way. And it's been really great to watch all the states that have adopted this as the norm rather than the exception as a result of that. And then there was the second part of this question that was in the Q&A was about PTCB item writing that Julie mentioned. So essentially at PTCB, our role is assessment, right? So assessing pharmacy technicians' knowledge to become a nationally certified pharmacy technician, as well as for some of those advanced and specialized certificate programs that we have. And we rely heavily on pharmacy technicians and pharmacists to write those exam questions. And so that's what Julie was referring to when she talked about item writing for PTCB. So thanks, Julie, for sharing a little bit more about your perspective there. Claire, I want to come back to you for a minute. So Julie kind of touched on the regulatory framework here in the United States and how it's not similar across the board. And in your role, at least from my perspective, you're doing things that here in the US only pharmacists would be able to do. It's not something that technicians would be able to do. And so can you talk a little bit about the regulatory framework in the UK and any role that you or your pharmacy technician colleagues have in advocating and pushing for change?
I don't know if I'm the best person to answer this question, but so we are, as pharmacists and pharmacy technicians are both regulated by the General Pharmaceutical Council in the UK, but we have separate registers. So there is quite a clear difference in what a pharmacist and what a pharmacy technician can do. I think it's a really exciting time to be a pharmacy technician in the UK at the moment, with lots of work going into the development of the role as a career, not a job. I think my role is so unique that I don't think I can speak nationally, because I don't know that I would know the answer, and I think I would be doing it a misjustice to try and pretend like I do. But locally, I think there isn't always clear guidance and a clear framework for what pharmacy technicians can do. And I think there are some of the struggles that I found in my role is finding that guidance and finding that framework and finding that, am I working within my scope of practice, has been quite difficult over the previous 4 years. But I think the transcribing and the medicine checks that I've talked about, we don't do solely without supervision. So I think, yes, a pharmacist would be able to do that without supervision and they would be making the clinical decision. But I think maybe the way I explained it maybe wasn't quite so. We would get questions as a pharmacy technician in this role saying, can this student, they've requested to have this baclofen via their gastrostomy, but they do take it orally. What can we do? So I could look up the guidance and I could look up the legislation and provide that to the nurses. I would only be providing that information to other registered professional bodies who also have a professional accountability and a clinical accountability. But solely the decision wouldn't be mine to make, because yes, as a pharmacy technician, we can't make clinical decisions, but under the supervision of the external GP or under the supervision of an external pharmacist who we could call for advice, we can find the legislation, find the guidance and provide it, but the clinical decision would always sit with another member of the MDT team.
Thank you, Claire. That's really helpful to understand how that works in practice. So I'll ask a final question of Samuel, which came in through the Q&A. And Samuel, I'm not sure if this is something that you have experience with, so let us know. The question is there a special role that pharmacy technicians can play in nuclear medicine research? Is that anything that you have come across in your experience?
Thank you for that question. Unfortunately, I have no, like in Kenya, we know that we not have any nuclear experience, nuclear pharmacy experience, so I might not be able to answer that question correctly.
No problem. I would say that I do know, at least here in the United States, there is a pretty big role for pharmacy technicians in nuclear medicine. I don't know specifically about the research aspect of that, but I will say that here in the US, there are, and actually globally, I have seen more of a push for pharmacy technicians to be engaged in research, sort of to what you talked about, Samuel. And so I would imagine that there is some opportunity in that specific area of pharmacy practice. So I want to thank you, Claire, Julie, and Samuel, for sharing your expertise and information about your unique roles. It's certainly inspiring to hear, and I hope that everyone here in attendance took something away from what you shared. Before we wrap up, I just want to share a couple of quick announcements. The first is that this is one of many digital events that FIP hosts throughout the year. You can find more information about those events at events.fip.org, and the recording of this will also be available at that same link. We still have another day of the Global Pharmacy Technicians Symposium, and I hope that you will join us tomorrow. We'll be starting at the same time, that's 1300 to 1600 Central European Standard Time. And we have another great lineup of speakers and moderators who will share their expertise in alignment with our theme of working together for the future of healthcare. So I hope to see you again tomorrow. And then finally, I wanted to make the announcement that FIP is planning for the 83rd World Congress of Pharmacy and Pharmaceutical Sciences. You can see here the dates, and that meeting next year will be held in Copenhagen, Denmark. Abstract submissions are happening now. You can see there that the important deadlines are March 17th of 2025. And then registration, of course, will be opening soon as well. And you can find the link there, copenhagen2025.fip.org, if you're interested in learning more about the Congress. So with that, I want to thank all of our speakers who shared their incredible expertise today. And thank you all for attending, and we look forward to seeing you again tomorrow. Thank you and have a good day.